Hello everyone, my name is Jordan Gascoigne and I'm a licensed health, life, and Medicare insurance agent with Supplement Plan Advisors Agency. When you're getting close to age 65 and able to go on Medicare, most people are feeling overwhelmed by all the mailings that they receive in the mail, the advertisements on TV, and the phone calls. Our agency helps people to figure out what they need, educate them about what Medicare is and the plans that would fit their lifestyle. I am here to talk to you about some of the pros and cons with 3 types of Medicare plans. I created this video to help people understand the differences so they can make a better choice for themselves and their lifestyles. There is no one plan that is best for everyone, which is why it is important to understand the differences of each plan so you can better prepare to make a decision for yourself and your specific lifestyle. There are 3 main types of Medicare plans today. The most common is Medicare Supplement plans. Then there are Medicare Advantage plans, and recently a new plan came to our area called a Medicare Savings Account, or MSA, which is actually a specific type of Medicare Advantage plan, but is very unique in how it works. So we're going to explain all 3 in this video. When you go on Medicare, there are a lot of things that Medicare does not cover, or certain time periods where Medicare coverage ends and there's no more coverage. That is why people get another type of plan to add additional benefits to cover the things that Medicare may not. The 3 plan choices are Medicare Supplement Advantage Plan or Medicare Savings Account. These plans do not work together and you cannot have more than one at the same time. The first one, and most common, is a Medicare Supplement. Medigap is another term for the same type of plan. When you have a Medicare Supplement and go to the doctor first bills Medicare and they bill your plan second. So Medicare pays their share if it's a Medicare approved service, the plan pays their share, and you are left with anything that did not get covered. When you first go on Medicare Part B, you have a 6-month enrollment window where you can choose any Medicare supplement and you are guaranteed to be accepted into that plan. After 6 months, if you want a Medicare supplement, you would have to pass a health questionnaire. Most of our clients love the network of this plan. You can go anywhere Medicare is accepted. Most people that like to travel, have kids in different areas, or are snowbirds love these plans because they don't have to worry about staying in network. As long as the facility takes Medicare, they will take your supplement plan as well. Medicare supplements can stay with you as long as you want them to. So, if you move to a different county or different state, you can take the plan with you. You will not have to switch plans. Here in Minnesota, Medicare supplement plans are standardized. That means that each company offers the exact same plans and you can choose a plan based on price. Medicare supplements typically cost more than other plans, but that is because they are more comprehensive. So you pay more each month, but if you use it, you will have less bills than if you went to the doctor for the same things on a different type of plan. Most people love Medicare supplements that want little medical bills, have health problems, and are worried that what medical costs could add up, or just want the peace of mind to know that they have very comprehensive coverage. Medicare supplements do not have drug coverage within them. So if you get a Medicare supplement, you would also want to get a Medicare drug plan. Drug plans can be pretty inexpensive, and here at Supplement Plan Advisors Agency, we can help you shop around and find plans that would work best for you and stay within your budget. We work with all the top companies and can help you find plans and companies that may work best for you and your lifestyle. The second most common plan is a Medicare Advantage plan. These are also known as Part C plans. If you get a Medicare Advantage plan, you would be getting your coverage from a private insurance company and not from Original Medicare. The private companies basically take over your Medicare benefits and administer your plan. They cover the same things as Original Medicare, but at different costs and copays because they are run by private companies. You can go onto a Medicare Advantage plan any year and there's only one health question, whether you have end-stage renal disease or kidney disease. Advantage plans have networks and they are usually just within your local area. So you have to stay within your network for all non-emergency needs, and if you go outside of your network, you may not have any coverage or you may be able to go outside but have to pay a lot more for services than you would in network. If you move to a different county or state, you typically would have to change plans if this plan is not available in that new area. One thing clients like is that you would only have one ID card, because most of these plans include drug coverage. Medicare Advantage plans can have very little premiums. The reasons they can cost so little is because Medicare pays the insurance company you pick to take on your risk and administer your benefits. These plans can cost very little, but that means you will have copays for almost everything you do at the medical facility. These plans can also offer some bells and whistles, like dental, vision, hearing, or gym memberships. At Supplement Plan Advisors Agency, we never advise people to pick a plan for the bells and whistles. We advise our clients to pick a plan based on medical benefits. Would you want to pick a plan based on how it covers cancer, heart attack, and stroke? Or do you want to pick a plan that covers dental and vision exams? Another thing about Advantage plans is that the insides of this plan can change each year. Things like copays, max out-of-pocket, deductibles, and the bells and whistles of that plan. The third plan is a Medicare savings account, and this is the newest type of plan and is not very well known yet. Medicare savings account, or MSAs, are a specific type of Medicare Advantage plan, but they are very different. They are like Medicare Supplements, where they have no network and you can go anywhere Medicare is accepted, but they have a very high deductible. When you choose this plan, you will actually get an allotted amount paid to you each year for medical expenses. You then go to the doctor and you can use the money you have been given to pay for services. But once you use the money you are given, then you pay all the costs until you hit the deductible. The nice part about these plans is that if you don't use the money that is deposited in your account, it keeps rolling over each year. So you could accrue quite a bit of money if you don't use medical services or you use very little services. These plans do not have a drug plan within them, so you would have to purchase additional drug plan. The funds are tax-free if you use them for qualified medical expenses, and if you stay enrolled through the end of the year and then switch to a different plan, you can keep the money you've accrued and take it with you to the new plan. Again, there is no one plan that is best for everyone. Everyone is different, and there are so many plans out there. That is great because different plans work better for different people, but can also be overwhelming to make a choice on which one's best for you. I would recommend looking at things like your budget. Are you willing to pay more each month to have more medical bills covered? Or are you the type of person that would want the comfort of knowing that you have comprehensive coverage if you're admitted to the hospital? Do the thought of medical bills prevent you from going to the doctor? Then maybe we should look at a Medicare supplement. Or would you rather have a low premium and are willing to pay copays almost every time you use medical services? Kind of like a pay-as-you-use-it or pay-as-you-go plan. Maybe the thought of a high premium is more worrisome than what the bills would be for medical services. Then maybe we should look at a Medicare Advantage plan. Convenience. Do you want to handle only one card, or are you willing to use 2 or 3 cards? Also, networks. Are you okay to make sure you are using in-network providers, or do you want to be able to go anywhere Medicare is accepted and have freedom to travel and take the plan with you? When picking a plan, your drugs can be one of the biggest factors. Most drugs have 5 or 6 tiers, and even though the specific drugs you take are a certain tier on one plan, they can be a totally different tier on another plan. This can cause hundreds and even thousands of dollars in drug costs if you're not looking at this correctly. Another thing I want to remind you is of Medicare Supplement window. If you go on Medicare Advantage plan first, and then later decide that you want a Medicare Supplement, you will probably have to answer a health questionnaire. And if you can't pass the questions, then you may be denied getting on a Medicare Supplement. Versus if you go onto a Medicare Supplement, you can go on a Medicare Advantage plan any year as long as you can pass the end-stage renal disease or kidney disease question. AEP, or Annual Enrollment Period, is the period at the end of each year where you can change your drug plan or your Advantage plan, but not your Medicare Supplement. Our main goal at Supplement Plan Advisors Agency is to help people, and nothing gives us more joy and satisfaction when we make our clients happy and can help educate them and save them money. We would love to sit down with you and find a plan to fit you and your lifestyle. Don't hesitate to contact us today because we would love to help you. Thank you very much. Have a wonderful day.